How can you get the most out of Medicare? Whether you're a senior signing up for the government healthcare program for the very first time or a current recipient, what you don't know about Medicare could hurt you. For example, did you know that in original Medicare, there's no cap on your out-of-pocket costs? Don't miss out on important benefits or leave money on the table due to ignorance. In this interview, Sharrese Sanders, sales manager and trainer at QuoteManage, will explain how to cap your out-of-pocket costs, why you need a prescription drug plan even if you have no prescriptions, how some of you could pay less than $5 a month for Medicare Part B premiums, why Medicare recipients should change their plans, what non-medical items certain Medicare plans will cover, and how a Medicare expert can help find the right plan for you at no cost. Because of social distancing, we will be conducting the interview via Zoom. Hi, it's Jeff Hoyt, editor-in-chief of SeniorLiving.Org, and today I have the pleasure of speaking with Sharrese Sanders. Sharrese is a sales manager and trainer at QuoteManage. Welcome, Sharrese. Thanks for taking the time.
Thank you for having me, Jeff. It's a pleasure to be here.
Medicare is really complicated for lots of people, so I just want to make it easier for people who are applying for Medicare for the first time or the 10th time. What it is that they should know, because there are things about Medicare that if you don't know, they really could hurt you. So what's one thing that people don't realize about Medicare that really could hurt them?
I would say that Medicare doesn't cover everything. A lot of people assume, great, I'm retired, I have my Medicare, I'm all taken care of. However, there are a lot of costs that Medicare is not going to cover. It will not give you a maximum out of pocket. So essentially, there is no cap on what you could be responsible for paying. And that can include 20% for medical bills. So any medical bills you pay without a limit, you could be facing those payments yourself.
So to be clear, if someone's hospitalized, has an accident or an illness, and they come out of it okay, but they run up $100,000 in medical bills, they could personally be responsible for $20,000 if they're on original Medicare?
If $100,000 of that is related to their physician services, then yes, they could be responsible for $20,000 of that.
Now that we know about that problem, what's the solution? How can people avoid that? What do they need to know?
Well, most people would do well to get a plan that is going to supplement original Medicare, some sort of Medicare supplement plan or a Medicare Advantage plan. Those are very popular because a lot of them are zero cost to you to have in addition to your original Medicare. So essentially, you get some protection and you don't have to pay anything additional if you put a Medicare Advantage plan in place and you pick one of the $0 plans.
And in that case, then if someone was hit with $100,000 in doctor's bills, there would be a limit of their out-of-pocket expenses?
Absolutely. They would have a very clear maximum out-of-pocket responsibility, which is outlined in their summary of coverage. And it varies based on the plan that they select. It could be, depending on where you live and the plans that are available, it could be as little as $900 to $1,000. Or as much as $7,550. But that is your worst case scenario number, and it is a lot better looking than $20,000 in the scenario we talked about earlier.
Indeed it is. So what other things do people need to know about Medicare that could save them big bucks?
The other thing is prescription drug coverage. Medicare Parts A and B, as we refer to as an original Medicare, it only takes care of your hospital coverage and your medical coverage, but you still need prescription drug coverage. Most people do. And if you reason that, well, I don't take any prescription medication, so I don't need it, that may be true for the time being. However, as you age, which everybody wants to live a long, healthy life, you may require some prescription drugs. And if you try to get prescription drug coverage later on, you will face a late enrollment penalty for the entire time that you did not have prescription drug coverage since you first became eligible. So it does you well to also get that prescription drug coverage when you are first eligible to avoid that penalty. And a lot of times those can be rolled right into your Medicare Advantage plan, again, at no cost to you.
So if someone joins Medicare but says, I don't take anything but a multivitamin every day, and they don't get a prescription plan, and then 4 or 5 years down the road, they need one, they're going to pay 4 or 5 years of penalties?
That is correct.
Did not know that. That is something
Indefinitely, too.
good to know. And we talked about Part A and Part B. Are there any ways with Part A and Part B, the original Medicare, that people can save money that they may not know about?
Yes, actually, there is. Depending on where you live, there are some Medicare Advantage plans that offer you a reimbursement on the premiums that you pay for your Medicare Part B. So, for example, if the standard premium is $148.50, then you may be able to get yourself into a Medicare Advantage plan that reimburse you anywhere from $25 every month, all the way up to maybe $144. It just depends on where you live and what is available to you.
So depending on your location and other factors, you could be reimbursed everything up to $4.50 of your monthly Medicare Part B premium.
That is correct.
Wow, that is a substantial savings. Now, do you know people who've learned about this, who have benefited from getting reimbursed?
Yes, I do. I actually was able to help one of my clients who called in, probably like a lot of Medicare recipients, a little bit unsure about how this whole thing works and if they qualify and if it's based on their income, just with a lot of questions, but most importantly, with the need to save money. So I was able to do a thorough assessment with her, and I realized that she actually qualified for a plan that was going to reimburse her $99 every month. And she was ecstatic, so was I. It feels good to be able to have helped her because she explained she's a senior on a fixed income, and $99 was going to make a huge difference in her life. So we were able to get that taken care of for her. And of course, all of this was at no cost to her. All she had to do was give me a call.
Great. Well, we'll tell people how to get a hold of you later. But that $99 a month in reimbursement, could she have gotten it earlier? Had she known about it earlier?
Yes, if she had called earlier, then she would have been able to get that earlier.
And one of the things I learned about Medicare from speaking with you is that it's not all medical bills, that other things can be included in Medicare Advantage plans as well.
That's correct. Some people assume, hey, I have this Medicare, or I'm okay because I'm pretty healthy. But there are other features or other benefits to a Medicare Advantage plan. So, for example, there are some plans that include fitness memberships, over the counter memberships. There are plans in certain areas of Florida that include companionship time for you to spend time with a student that can help you with running errands or technology, even just playing a board game. So that's just a few of the other benefits and programs, social programs, and community resources that could be had with getting a Medicare Advantage plan. And they're included in the plan at no cost.
Wow, I like that price tag. So you have people every year during the annual enrollment period that are signing up for the first time. They've hit 65, and they have to learn a whole lot about Medicare in a short period of time. But what about the people who've been signing up? They're 70, 75 years old, have done it year after year after year. Are there things that they don't know that could help them if they did know about it?
Absolutely. Every year, the plan offerings, they can change. So if this person selected a plan a few years ago and it worked just great, they may feel like I can just stay in this plan. And you could, but it would do you well to review what is available because every year prescription costs can change, the doctors that are in and out of network can change, and the offerings themselves, they can change. Sometimes they increase, sometimes they decrease, and you could be saving money on prescription drugs, or you could have greater access to doctors and other programs just by reviewing what's available to you this year, because it doesn't necessarily mean that it's the same from what it was last year.
So if someone takes a particular prescription drug daily, it's possible if they just renew their plan, they may not realize that the price of that has doubled or tripled and that they'd be better off with a different plan.
That is correct. They could get into a plan where those prescription drug costs could be greatly decreased. There's new insulin savings programs and other features that will help someone who is having to pay for medications to maybe reduce that significantly, or sometimes we can get that down to little or nothing.
Wow, that is impressive. So you mentioned a real life anecdote before about someone you helped with Medicare. Any other people that you could say you helped by teaching them things they didn't know about the plans?
Yes. So this lady sticks out in my head. She actually called me, her and her brother called me in distress. She did have Medicare, but she was a senior with a fixed income and she was facing eviction. She didn't know what to do. She literally was just making phone calls to see if there was anything she could get help with. And she ended up speaking to me as her Medicare representative. And I was able to find a plan for her that had a program which actually helps its members with community resources. So they were able to connect her to an organization that found her emergency temporary housing. That was life changing for her. She was in tears. They were also able to connect her to reputable companies that could help her with being able to move so quickly. You can imagine being a senior and you have all these things that are important to you, and you're trying to figure out, where am I going to take my things? And I have nowhere to go, and who can I trust? They were able to connect her to organization that was able to help her to move her things at the last minute, help her to feel a little bit more secure. So all of that was included in her program. It was zero cost to her for them to connect her with those type of community organizations in times of crisis assistance, or even if someone was to happen to need adult daycare or um, other services, then they would be able to have that connection just by using their plan.
Medicare Advantage and supplemental plans cover a lot more than just medical needs.
Yes.
So how does someone get a hold of QuoteManage? Tell me a little bit about what QuoteManage does and how people can reach out to you.
QuoteManage, we are a Medicare broker. We have a variety of Medicare plans, both Medicare Advantage, Medicare prescription drugs, and Medicare supplement plans. So we can do a thorough analysis of your particular circumstances, because this is going to be individualized, and we will look at your doctors, your medications, your pharmacy, and take into account any needs that you express are important to us. We'll do all of this by telephone for you, and there's no cost and there's no obligation. So we're happy to assist.
Great. Really appreciate your help. Thank you, Sharrese, for taking the time, and I learned something today.
No problem. Glad I could be of assistance.